Alveolar bone remodeling. Alveolar bone is the part of the jawbone that holds our teeth in place, and it's constantly changing in a process called bone remodeling. This process involves breaking down old bone and forming new bone, which is essential for keeping our mouths healthy and supporting strong teeth. It responds to everyday activities like chewing and even to dental treatments like braces. Special cells work together in this process. Osteoclasts remove old bone, osteoblasts build new bone, and osteocytes help sense pressure and stress to guide the changes that are needed. A key part of how this system works is the balance between two proteins, RANKL and OPG, which control whether more bone is formed or broken down. When this balance is off, bone loss can happen, leading to problems like tooth loss or gum disease. Luckily, science is developing new ways to help the bone heal or grow back using advanced treatments. These include using special proteins that stimulate bone growth, stem cells to help rebuild bone, and scaffolds that mimic natural bone to support the healing process. These methods are becoming very useful in treating damaged or lost bone due to injury, disease, or tooth removal. Understanding how the bone remodeling process works at a deeper level, along with these new treatment methods, offers promising ways to keep teeth stable, improve dental treatments like implants or braces, and maintain long-term oral health. Introduction. Alveolar bone is the special type of bone in the jaw that holds our teeth in place. It constantly goes through a natural process of breakdown and rebuilding, known as bone remodeling. This process is balanced by two types of bone cells: osteoclasts, which break down old bone, and osteoblasts, which build new bone. Keeping this balance is essential for maintaining healthy gums and stable teeth. However, in conditions like gum disease, periodontitis, this balance is disturbed. Bacteria collect near the gums and trigger the body's immune response, causing inflammation and the release of substances that damage surrounding tissues, including the alveolar bone. Over time, this leads to bone loss and tooth loosening. Alveolar bone reacts to various factors, including bacteria from dental plaque, pressure from braces, genetic influences, and health problems like diabetes. The bone doesn't just show what's happening now, it carries a history of disease. Unlike soft tissues that respond quickly to current inflammation, changes in bone take longer to develop, making them indicators of long-term damage. Understanding how this bone breaks down and rebuilds helps dentists better diagnose and treat periodontal diseases. Treatments like bone grafts and regenerative materials can help preserve bone and support tooth stability. Scientists have found that the immune system plays a big role in the health of alveolar bone, a field known as osteoimmunology. Although we know a lot about bone remodeling, researchers are still working to uncover exactly how the immune system and bone cells interact during disease. Gaining a clearer picture of these processes will lead to better treatments to prevent tooth loss and maintain healthy smiles. Improving our understanding of this complex system continues to be a major goal in modern dental care. Conclusion. Alveolar bone is the part of the jawbone that supports and anchors our teeth. It constantly changes through a natural process called bone remodeling, where old bone is broken down by special cells, osteoclasts, and new bone is built by others, osteoblasts. This balance is essential for keeping our teeth stable and adapting to changes like aging, chewing pressure, braces, or dental treatments. When this balance is disturbed, especially by gum disease, periodontitis, more bone is lost than replaced. This can lead to loose teeth or even tooth loss. Maintaining healthy alveolar bone is important not just for keeping teeth in place, but also for successful dental treatments like implants. Periodontists, gum specialists, work to prevent and treat this bone loss. They use advanced tools like bone grafts, growth factors, and imaging technologies to encourage bone healing and regrowth. By understanding how bone remodeling works, they can create treatments tailored to each patient's needs. Health conditions like diabetes, osteoporosis, or hormonal changes can also affect this process. That's why it's important for dental and medical professionals to work together. With ongoing research and new therapies, protecting and restoring alveolar bone is becoming more effective, helping patients keep their natural teeth longer. This important article is authored by the following scientists: Thank you for watching this video. Please subscribe to our channel BP International to watch more videos in the fields of science, technology and medicine.